There are many areas of the country, many states, many regions that spend on their Medicare beneficiaries far less than the national average. For example, the state of Minnesota is 21% less in terms of spending per beneficiary than the national average for its Medicare patients. And at the same time, there are particular regions within states that spend far more money. So the news media have begun to realize that spending, for example, in Miami, Florida, exceeds $16,000 per Medicare beneficiary. And here in the state of Minnesota, we're less than $7,000 per Medicare beneficiary. That extra spending doesn't lead to better health. In fact, the best available data shows that quality measures in Medicare beneficiaries are actually inversely related on a state-by-state basis to state spending. So the states that spend the most money do the worst from the standpoint of quality measures. The recent story in the New Yorker magazine about McAllen, Texas, brought this out very well. Things are obviously done differently. There's more of a business mentality in medicine in McAllen, Texas, and because our current incentive system basically pays for procedures, a physician who does more procedures is paid more. The physicians in McAllen, Texas do very well by ordering more tests and doing more procedures. They have more income, and the spending on Medicare beneficiaries in that state, or in that region, is far higher. As the New Yorker pointed out, more than twice as high as in El Paso, Texas. But the New Yorker didn't point out that there are other regions in Texas, Temple, Texas, Waco, Texas, that are even lower in spending than El Paso is. So that there's more than a factor of 2 difference in spending across the state of Texas in different Medicare regions, with no difference in outcomes, and it's not accounted for by differences in fees or differences in the patients. Texas is not alone. The state of Florida has the same extremes. Sarasota, Florida, Tallahassee, Florida, those regions spend less than the national average per Medicare beneficiary, something between $7,000 and $8,000. Meanwhile, Miami spends more than $16,000 per Medicare beneficiary, more than twice as much. Florida has some of the most extreme examples. Fort Lauderdale, Florida, does spend more money than the national average, about $9,800 in 2006 per Medicare beneficiary. But it sits right next to Miami, which spent more than $16,000. Actually, 65% more spending per Medicare beneficiary than in Fort Lauderdale, right next door. I don't think we can continue to spend money this way. I think we need to recognize that the incentive system is encouraging a lot of spending that isn't leading to better health. And Mayo believes that one of the cornerstones of healthcare reform ought to be a change in the incentive system that begins to adjust in terms of payment to both physicians and hospitals for the fact that they are in a high spending region. So that rather than having Medicare reduce reimbursement for everybody in the country to try to keep spending under control, that it more selectively adjust reimbursement to try to encourage more efficient use of resources in these high-cost regions.